Hello, good morning. I am Dr. Umar. Today I would like to speak on Bell's palsy. I think you know what's Bell's palsy. It's quite a common condition where there's a weakness of one side of the face, either right side or left side, with involvement in the frontalis, this muscle, all the facial muscles. Sometimes they may be pain be behind the ears called a retro-auricular pain. Sometimes there will be a watering from the eyes as well as a taste disturbance called dysgeusia. Okay, sometimes there can be a hyperacusis or more sound sensitivity or abnormal sound in the ears. So whenever this comes, you should think of a condition called Bell's palsy. This occurs over a period of 24 to 48 hours. It can progress up to 5 days, and usually they tend to improve within 3 weeks to maximum maybe within 3 to 6 months. All right, this is quite common. Maybe this occurs 30 to 50, 60 per lakhs. Both genders are equally affected, both males and females. But as you ages more than 70 years, this tends to increase rapidly. All right. So basically the cause is idiopathic, means we don't know the cause. But most of the cases, studies have shown that there is a in the perineural fluid, or the fluid taken from around the nerve, showed some positivity, PCR positivity of the herpes simplex virus 1. Okay, there are other viruses also which can cause this called Bell's palsy, like herpes zoster Y viruses, HIV Y viruses, some bacterial infection like leprosy, Lyme, and various other infiltrative, infectious, inflammatory, traumatic or neoplastic conditions. So basically Bell's palsy means idiopathic without any definite underlying pathology. It is a self-limiting illness, occurs within 1 to 2 days and tends to improve within a matter of 2 to 4 months. All right. So we don't usually require investigation like high-end investigation like MRI, CT in most of the cases, 99% of the cases. But maybe in certain cases where the disease tend to increase in severity, is no improvement at all even after 3 months, or there are associated severe pain. But pain can occur. But if it is a this continuing pain without any known cause, or some other associated condition, or getting recurrent attacks, or in the history, if there is a history of fall or trauma to the bone and thing, in those cases we may have to do investigation like MRI of the pit of the posterior fossa or the base of the skull, or CT of the skull, maybe the temporal bones, the parotid region, the posterior. So in those cases we may have to do investigation like a CT, MRI. All right, and there are certain conditions called Lyme, especially those people who dwell near the forest, especially if they had a tick bite, they are prone for certain condition called Lyme disease, LYME. So they can present the pain in the joints called arthralgia, and some skin lesion called erythema, migraines, and facial weakness. And the treatment is different compared to the Bell's palsy. So Bell's palsy, probably the blood test, you may have to do a blood test like blood counts and EESR and blood sugar, because it's very common in diabetics, because the treatment has to be modified, because if you give steroids in these conditions, the sugar tends to go up. So we have to know what is the basal blood sugar, and then you have to modify the insulin or the oral hypoglycemic agents accordingly. So the symptomatology is you get a weakness on one side of the face, starting from the forehead to the platysma. So there one muscular platysma, and when you speak, the lips tend to draw to one side and can't blow or whistle, and when you take some fluid and this tends to drool from one side. Sometimes there can be a loss of taste from the anterior 2/3 of the tongue, as well as sometimes there can be some sound sensitivity in the ear. This is the in total the symptomatology of Bell's. Usually there won't be other symptoms like weakness of limbs, loss of consciousness, seizures, difficulty in walking. But there is one condition called Ramsay-Hunt syndrome, where this affects one genicular ganglion. Sometimes they might be the symptoms may be with dysphagia, vertigo, and unsteadiness, but it's very rare. It's called Ramsay-Hunt syndrome if it affects the 8th nerve in addition to the 7th nerve also. Which are the conditions which can simulate a Bell's palsy? You should know that all the facial weaknesses are not Bell's, but majority are Bell's. Because just imagine that somebody is speaking or attending a conference, suddenly the face droops to one side. It is not Bell's, because Bell's starts over a period of days, maybe 24 to 48 days, hours, and then progress up to 5 days. But on the other hand, stroke comes like this within seconds. Suddenly, when you are speaking, suddenly coming like that, you should think of a problem in the brain, like a face area or the subcortical area or in the brainstem, anywhere. So, in those cases, how to differentiate whether it's a Bell's palsy, whether it's a stroke. One is the suddenness, sudden onset, it's a stroke. So, vascular event, maybe a bleed, maybe ischemic infarct. Then secondly, in stroke, what happens is the reflex will be maintained. Suppose if you, it's called a globular tap, it will be normal. And if you close the eyes in Bell's palsy, this tends to go up. It's called Bell's phenomenon will be there. It will be low. It is absent in case of stroke. And when you crack a joke, if the patient is having a stroke, his smile will be normal, because there is a sparing of the emotional fibers. There are fibers destined for your emotions in the face, because you are not just because there are so many muscles. This tends to express your anger, your emotions, your mirth, your laughter, many things. The same way, this is being controlled by one area called the temporal lobe in the brain. So there are certain fiber systems which innervate the facial muscles through the 7th nerve. These tend to be spared in case of stroke. So similarly, taste sensation will be lost in case of a Bell's palsy. This doesn't occur in stroke. Similarly, the pain, retro or auricular pain, and this unilaterality, because stroke tends to spare the upper part of the face and it will be in the lower part of the face. And of course, we can do a nerve condition study and the EEMG study and other. If it's a stroke, usually this tends to affect on one side of the body or the opposite side of the body. There will be either a crossed weakness or ipsilateral weakness. So depending on this symptomatology, you know that whether it's a stroke, whether it's a Bell's palsy or something. Then secondly, there are so many conditions like infiltrations, like leukemic infiltration, lymphomatous infiltration or carcinomatous infiltration, basoskull lesions. This can infiltrate the nerves and can simulate and can present with a Bell's palsy. This is a facial weakness. But this tends to progress over the course of 2 to 3 weeks or so. And maybe other nerves gets affected in due course of time. Like lymphoma, I've seen a couple of cases starting with facial weakness, maybe after a month getting one more nerve, other nerve, this side, that side, and the investigation like MRI with contrast and peripheral smear, LDH and uric acid shows that there is a leukemia or lymphoma. And so secondly, acute onset of facial weakness, always you have to think of a lesion in the pons also, like a Pontine infarct, isolated nuclear lesion involve the 7th nerve nucleus, or a hemorrhage in that location, or a demyelination like in multiple sclerosis, okay, or a Pontine glioma if it's occurs in a young child coming with a facial weakness. Always think of a Pontine glioma, okay. Any epidermal or CP lesion, this can affect the 7th nerve, 8th nerve and 5th nerve, but those cases the weakness tends to get worse. Unlike in Bell's palsy, where it tends to improve over a period of 2 to 3 months, this tends to get worse. And there are so many conditions like sarcoidosis, Melkersson-Rosendahl syndrome, various drug induced like interferon and linezolid and various vaccines, pregnancy, various traumas, then neurinomas, schwannomas, and Guillain-Barré syndrome. There are so many conditions which can simulate a Bell's palsy. So you should have in your differential diagnosis, you should have all this with you. Like this may not be a Bell's palsy, this may be a Bell's palsy, but of course you have to look out for the other causes. And by the way, do you know the treatment for Bell's? Basically, it's simple: physiotherapy, then steroids for 5 to 10 days with a rapid tapering. And if there are most severe weakness, or if there's a Ramsay-Hunt syndrome, you have to start on antiviral like acyclovir, valacyclovir or famciclovir 5 to 7 days. All right, and should advise patient to avoid injury to the cornea. They have to wear a specs while traveling, and they should have a taping over the, it's a horizontal taping, and shouldn't cross the vertical so that it shouldn't touch the cornea. And they should have a massaging, and you can use the chewing gums and inflate balloons and various therapies, stimulations and physiotherapies. In the acute phase, what I do is, suppose there is a more significant facial shift to one side, we can put 5 units of Botox to the opposite side. And post Bell's, there may be so many complications. After Bell's palsy, what are things you can do? One is you can continue the physiotherapy. Suppose if there is a lag of thymus, suppose if this tends to get open like this can injure the cornea. In those cases, we can ask get your ophthalmologist help and can do a tarsography. Or you can put a botulinum toxin to the levator palpebrae superioris, and this can cause a therapeutic ptosis or a protective ptosis, can give 5 units maximum there. Secondly, if there is a spasm called post-Bell's hemifacial spasm, you can give lower dose of Botox to these hyperactive muscles. There are certain conditions called crocodile tears, where you may have to use Botox to the glands, to the lacrimal gland. 5 to 10 units you can give. I have given in a couple of cases with very good result. Then secondly, there can be conditions called a jaw wing phenomena, or other aberrant re-innervation, when the nerve tend to regenerate, this and to innervate different muscles instead of jaw wing phenomena, crocodile tears, post-Bell's hemifacial spasm, many things can occur. So my point is that Bell's palsy is quite common. We have to look out for other secondary causes like leukemia, lymphomas. Though it's very rare, you might find it once in a decade, because I have seen. That's why I want to tell you, because all those Bells are not malignant, but maybe once in a while you can pick up a case. So this basically to my doctor colleagues, because I want to explain all these things, because you might pick up, because if you look out for that, you can get a leprosy, you can have a Lyme's and a sarcoid, then the Guillain-Barré, because bifacial variant, there is a variant called bifacial variant of the Guillain-Barré. Sometimes they can spread, or maybe restricted to site restricted variant. So okay, so the treatment is rather simple: steroid physiotherapy and botulinum toxin. If you are very confident and if you are well experienced, you can start with that. And I hope this video is effective and fruitful, at least to some of you, because this basically I have intended to my professional colleagues. Of course, anyone may be benefited, because I would like to share some of my experience, because I have seen patients coming with Bell's palsy, like bar palsy, but the onset is acute, and the imaging showed a small bleed in the nuclear region, the pons, or infarct, or a demyelination. So of course, and I have presented in some of the international journals also. So you can also look out for this rare conditions if you are, if you really look out for this condition. Thank you very much. Bye.